All right, Danny, thank you so much for taking the time to share your experience with other patients. I wanted to ask you a couple questions to just let us know how long you've been seeing Dr. Furley and what are your experiences. So, how did you find Dr. Furley?
Um, well, I found Dr. Farley through a pastor friend of mine who I confided in, and just so happens that his wife was a patient of Dr. Farley's and was definitely helped, and so it was suggested to me that I come and see him, and that was after seeing 4 to 5 other doctors who had no answers. So, yeah.
And how long have you been seeing Dr. Furley for?
4 years now.
4 years. And originally when you came, you had a lot of gastrointestinal issues. For example, you told me about constipation. So tell me about your constipation.
Yeah, it was pretty severe. Not knowing at the time that I had other things going on, I couldn't really explain it or fix it. Even gastroenterologists really couldn't figure out what was going on. So it was pretty severe. It was severe for a long time. And then, and then I was getting a lot of pain and other issues as well. So, yeah.
And after you started seeing Dr. Furley, you mentioned it was 100% gone. Is that correct?
Yes. I mean, if I eat something wrong now, or it occasionally pops up, but that's normal in normal situations. But no, I don't have it chronically. No.
Great. So after your constipation is gone, how did that change, or how did your lifestyle better?
Oh, it was day and night. I could actually start to eat again, and yeah, it was just day and night for sure. And then as the SIBO got a little bit more manageable, gut overall health got better.
Right. And one of the doctors you mentioned diagnosed you with slow bowel.
Yeah, he was a SIBO specialist in Manhattan, and after seeing 3 other doctors plus my intern who had no answers at all, I figured I'd seek a SIBO specialist since I had a lot of the symptoms. So I went to see him. He did a gut motility test, which came up slow. He said you have slow bowel, and you definitely have SIBO. He did a SIBO test, which came up positive. On top of having autoimmune, which complicated the whole thing. So, but again, while he diagnosed it, he really didn't have a long-term answer. So, yeah, so
Right.
that was that.
And after you started seeing Dr. Furley, how much did that improve?
Oh, it was drastic. It was 60 to 100% to 90% better than it is. I mean, I couldn't function at all. It was really, really bad. It was getting to the point where I was out of disability from work, short-term disability, because nobody could seem to figure out what was going on. So I was just getting worse and worse. It's been a slow process, but in following to the letter what Dr. Farley ordered, it's been progressively better and better for sure. Yep.
That's great. That's great to hear. And before coming to Dr. Furley's office, tell me, what were your symptoms? What could you do? What could you not do?
Okay, I had a lot of pain, upper left quadrant in my gut, pain constant to the point where it was constant for about 6 months. On top of nausea and constipation, and it seemed like everything I ate just made me sicker. So there were really no real answers. Once I came to Dr. Farley and we really got down to the grassroots of what was going on and figured out that I did have dysbiosis in my gut. I had the SIBO. I had a lot of other vitamin deficiencies going on that I didn't even realize I had. Vitamin D deficiency, B, you name it. So when he started adding the supplements on top of the treatments, like I said, it's been a slow process, and SIBO is not something that just goes away, but I mean just gradually better and better as I've come here. It is the only one that really had answers at all, for sure.
And so before you were barely able to eat, but how is it now? Are you able to eat more? I know you're on like a certain restricted diet, but are you able to eat some things?
Yes, definitely. I eat, I eat 3 meals a day, actually 6 small meals a day. I break it up. But yeah, I'm definitely able to eat more things than I was before. I understand SIBO better. I understand what I can eat and what I can't eat. And I think I know my body much better than I did before, and that's really important to understand how things function and how what you eat affects how you feel.
Right.
So yeah, it's for sure been a learning experience for me.
And did you lose any weight when you were barely eating?
Yes, I lost a ton of weight. I'm already thin, and I lost a lot of weight, and I couldn't put on weight. I couldn't gain weight, and probably because I wasn't eating as much. You also have all kinds of vitamin deficiencies going on.
Right.
So yeah, and also wasn't absorbing what I was eating. So because
Right.
the growth of bacteria was so bad that the bacteria was stealing all the nutrients. So
Right. And before you came to Dr. Fraley, because of your SIBO and all the pain, you were having anxiety and depression symptoms as well?
yes, yeah, since I wasn't getting any answers and felt like there was kind of a dead end, it's a tough place to be. So, you have to find the strength somewhere to be able to pull out of it. So, and when I came here, it gave me hope. So.
Right. And you did mention you went to a doctor that wanted to prescribe you antidepressant medication, but you said you did what with that medication?
Yeah, he once he diagnosed me with the SIBO, and then after 2 rounds of antibiotics, and then changing my diet slightly, and I wasn't really feeling that much better. He says, "Oh well, I think that maybe you need to see a psychiatrist and go on to antidepressants or anti-anxiety medication." And I knew in my mind and heart that that wasn't the answer. That this was not in my mind. That I just needed a different, a fresh view on what was going on. So, yeah.
Right. And so after you became a patient and you were trying to get rid of your severe anxiety some way, and how did you do it with Dr. Fraley?
Well, Dr. Farley, has had some things that he had given me, some supplements that really, really helped me. Gabaflow spray, GNT or Gabatone, which is an all-natural, anti-anxiety, and that definitely helped, no doubt. On top of, getting my vitamins up to where they need to be, B12, B6, that's all part of fighting anxiety, So there was that and a whole lot of prayer.
Right. Oh. And you said with the SIBO, it also came with nausea, pain.
Yeah.
And tell me, how did those improve after seeing Dr. Fraley?
Yeah, I very rarely get the nausea now. Some mornings I do, but oftentimes I know it's because maybe I ate something that was, not SIBO friendly. Yeah, sometimes I cause my own issues, but at least I know what's going on now. Before I had no idea.
You know what you did
I know
wrong.
what I know. Yeah, and
Right.
so yeah, and then all the other symptoms have been about a 65 to 70% improvement.
Is that the same for bloatiness and gas?
Yeah.
Okay, great.
Yep.
All right. So, anything else you would like to share?
No, just just this, that if you're not getting answers from medical doctors, don't continue down that road, because it's all they're going to do is just give you medication on top of medication on top of medication, and it's never going to get fixed. It's really not. It's just not. I've learned that lesson. I tried to go to really good doctors with a lot of degrees on their wall, and supposed to have all the answers, and they just didn't have the answers.
Right.
So and if you could go in a natural route, that's all the more better for your body.
Right.
Definitely.
And you know this because you've been to so many doctors. How many doctors in total did you go before coming here?
4 to 5 different doctors. I went to 3 or 4 gastroenterologists plus my family doctor, intern. And in his defense, was not a specialist in gastroenterology, but was a family doctor that I knew for years, and I trusted him, and so he basically just recommended other doctors, more or less,
All right. Well, we are happy to have you. More better days to come your way, and we thank you for your experience and sharing your experience, and we wish you health. Thank you, Danny.
Thank you.